No. They're still on scene, like getting their stuff done. Both bags, okay. As you should. Every day, yes, you should check them. There was stuff missing this morning, and I was like, oh, I was this close to just leaving it. Like, fuckers, I told you. And I didn't. I'm nice. Mm-hmm. I think so. There's a thing. Sweet. That's what I'll do. Ready?
Just checking with them to make sure they can see it.
Oh. For Phelps, you guys in the sim? I was gonna say it's a standard at this point. It's never going away. Alright, sweet. We'll go. We'll grab our bags and head over to our
Hey, how are you guys?
Good, how are you?
Doing well, doing well. You got called, somebody driving by, saw this dude, apparently motorcycle versus deer, no helmet, went across the road. 85, he's about 85 over 44 now. Our partner's got 2 IVs started.
250 bowl.
Wife sent him a text last night about 8 o'clock, last time anybody's heard from him. Got quite a bit of blood in a couple spots. About all we know about him.
He's bagging pretty easy with no PA.
He is back easy with no PA.
32-year-old male.
That's all we got.
32-year-old male.
Yeah, wife's in around the COX out right now.
Okay. So I'm walking up. Any extensive bleeding when I first walk up?
You're gonna have to take a look.
All right.
Alright, I got a heart rate of 130. Blood pressure is 85 over 40 and 91% right now. Not good. What do you want?
Pressure here.
Okay.
Hold that for a second. See if that bleeding stops. Airway, said we're doing good with.
Still a whack to the forehead.
Right there.
Blood's pretty good for the time.
There's a lot of blood down here though.
Still bleeding.
All up in my pants.
Oh, that's. Gotcha. pressure there.
Okay.
Hold that. Still tacky. Got 2 lines. You guys have fluids.
Yeah, 250 bullet
Is it still hanging?
ran through. We ran it through.
Ran it through. Okay.
Let's pressure up a little bit, not much.
Okay. We'll make sure that we'll get. Are we in the ambulance or are we on the ground?
We're out here.
Out here. All right. So, you guys got any fluids on the
No,
truck?
that's all we had was
All right.
that 250.
We'll go
We
from
just
there.
switching it.
Holding pressure here. Airway's good here.
Yeah.
Sounds like we've got breath sounds. Just have pulses.
I've got a good one. It's Friday.
Yeah.
130, 80, but yeah, I have one. We have, looks like it felt and sounded unstable. Teapot's in the aircraft. Okay.
Keep pressure here. I'll run back and grab teapot.
Okay.
Good.
I'll wait.
All right. Big time there.
Yep.
All right. There. Handle that out there. Okay. Ready to switch over?
Yeah.
Ready? 1, 2, 3. You good with airway right now?
Yep. That's down there with.
All right, great. 1, 2, 3. Aircraft. bags on the way. I'll be responsible for dropping that.
This is a no drop zone. What do you do that? I'll be back there, please.
You did not.
Okay.
Alright. Bagging.
Bagging.
We got fluids. Not a bag of saline, but maybe spike everything. We got IV tubing over there.
Yeah. What are we doing?
I'm just starting fluids until we get blood going.
Okay.
We're gonna have to tube, but I'd like to get some blood and fluid started first, so we can get fluid started quickly. Get it going.
Ooh, we go after blood.
What's that?
I'll just go after blood.
Plasma. You need to prime all this?
Yep. We'll actually blow it.
It's on oxygen, right, bag?
Yes.
Jesus.
Here's a towel.
Clamps.
I know, right?
That's good. This AC okay for the drainage?
Yes. Yep.
Spiking.
Yeah. You might.
Too early. Appreciate you.
Mm-hmm. There you go.
You got blood in my eye.
Goggles. It's alright, it's just vinegar. It'll be fine. Probably.
Alright. Thank you. That one's open, that one's closed. Alright, blood's running in. IV catheter's coming out.
But you can just clamp it at the bottom.
Clamp it.
Yeah. It's leaking. Deal with it. Alright. Plasma's going.
Alright, plasma's going. Get ready to tube them, and we'll recycle another pressure with this front end. Get some nasal cannula running. Go past it. Alright, that's on. pressure bag that in if we need to.
Okay.
Pressure's low, so. Go on here. There's one. Say that's a 7.5. We're still getting equal chest rise and pull.
I can't tell, I can't see, but he's bagging just fine.
Section. Suction to CMAP tube holder in line. Ketamine and rock, and he's got a decent head injury, so we can do 100 of fentanyl before 2.
I think the plasma's done.
Okay, let's set up another. We'll do PRBC.
Don't pull the thing. Okay.
It's gonna be a mess. There's fentanyl. Ketamine. We're pulling up. Empty.
Yeah, I mean, at least a year. Probably
Say-
everywhere else.
Say 80 kilos. You got another needle over there.
You have one.
Alright, drawn up 100 of fentanyl. We'll go ahead and give that. We've got that other blood on the pressure bag. 100 of fentanyl's in. Drop 80 of ketamine. Per ml. So we're gonna go triple 1.5. Ketamine's in. Right. Follow up rock. There's 110. Follow up 8 milligrams per ml. Rock's ready. Ready? Ready to switch you?
Yeah. Yeah. Movie magic.
Still at 80%. But we've resuscitated. We've got a second bag of fluids go, or second bag of blood going. Give this rock. That's 80.
Gotta keep bagging him. Are you ready for the rock?
Yeah.
Okay, rock going. Rock is in, 10:17.
And we'll wait 1 to 2 minutes. to mess with it or
Oh, that's okay.
Check the pulls while we're waiting. They're not very responsive now. Alright, in a minute.
Actually, yeah, you're at 1 minute, 30 seconds.
Hold it ready. Alright, pull this. Normally I would open this, but it felt like he had a little bit of instability down there in his neck. To try with the seat cover on. We've got equal chest rise. I can't tell if these pupils are supposed to be equal, but they look unequal. So we've got our oxygen's up, pressure's still low. We're giving our second bag of blood. We can put up some calcium if we have time, give that with the blood. We can also pull up some, or mix some Ansef if we have time. A gram of that on the way. Is this blue in the mouth supposed to be there?
Yeah, it's probably hypoxic.
Alright. Heart rate's coming down a little bit.
Alright, gram of calcium.
Pull up a gram of TXA too. TXA before the calcium.
So going to the same place?
Yeah. Still 80s over 50s. If this blood's done, we could always spike another one. Another unit of blood.
Alright. Calcium is in, and then TXA is starting here.
Okay. Pupils do look uneven to me. We can hang some 3% if we have time.
Here's our third unit of blood.
Unit of blood. TXA. Pressure's coming up. Heart rate's down. End tidal 32 is 96%. We've got.
Good thing it wasn't a bumpy flight. That might have got ripped out.
Knee bag for a second, please.
Yep.
It's never a bumpy flight. It's 902.
much 3% did you want?
We'll start with a 250 bolus.
250 bolus. All right.
And then we can get our vent turned on.
All right. Your scenario is complete.
We're done.
All right. Anything you want to do or take away?
Probably would have caught the pupils sooner.
Yeah.
If they aren't even. I didn't like that I think TXA sooner too. I didn't like that his vitals weren't stabilizing before that. TXA we could have done as soon as we got in with the blood. We got pelvic binder on. Got our calcium. ANSEF could have been a later thing after the TXA.
How about your two? What was your blood pressure when you intubated him?
80/50.
Is that great?
No.
No.
I
So,
don't want to push those.
sure. Was he hard to bag?
No.
No. And his stats were honestly, they had been okay. He finally dropped down to 88, but I know why. That was different. So, like, one thought is, like, why not throw an LMA in that I can ventilate with? Because then that leaves this person's hands open, right? I can ventilate them that way, and then we're gonna full charge on getting product and all that kind of stuff in. LMAs are still a good tool, and then once he's primed up and my blood pressure is correct, and now I can give meds, okay, yeah, let's tube him. You know, it doesn't mean don't tube him, it just means let's make sure he's all primed up and good to go first. Because that patient probably would have coded on you. Or gotten close enough that I'd be doing my normal things. So that's just a thought. You recognize you needed blood right away. The pelvic binder, that's gonna kind of be up to you. Obviously, we're 15 feet away, but normally we're a lot farther, right?
That's kind of what I was.
So,
I was just trying to weigh moving them with an unstable pelvis versus not.
right. It does get tricky because we've all been there where you get there and you're like, oh, this is way worse than anybody portrayed.
Yeah.
So that, I mean, that is what it is. If I was in real life, like we were far, far away, I'm gonna just go with, he's already on a backboard. I'm gonna go, we're gonna take the patient with me because he needs a surgeon at the end of the day, and none of that is out there.
Yeah.
So that would be my go-to. And then on like fluids versus blood, if we're coming all the way out here, it is just as fast for me to put fluids on the blood tubing and get that started, and then stick blood on the other side.
Yeah.
Because that's what they need, right? Sweet. Text me. Shelly, will you text me any further questions? Or call? All right. Let's real quick reset. Did you have a question? I'm
I
sorry.
said, was there a question?
Oh, I don't know. We were just trying to figure out how to do debriefs when we're far away. Okay.
plug into that?
Calm down, Mr. Johnson. Andy Johnson. We did talk about it, not David, right?
It's alright, don't say it then. You know what I mean? Like, we'll just.
Yeah. I like it.
There's two like similar pieces you plug back and forth between, so they're getting it crossover. All that matters is they're the same.
The same every time.
Yeah. Yeah. Some of them I know are detailed in my brain. I'm like, isn't this one? And they're all running together.
Okay, good.
Always drop anything for problem of these are jobs. Don't break anything. Including yourself. Slow down.
Never broke a vent, but I've broken it. Door.
Can't do either. There is some cost to be just there inside the door.
Lucy, would you make sure that drain bag is still
For what?
the drain bag is still plugged in the back of the side?
Looks to be.
Yay.
I don't know what jackass did. He's dropped. And I forget about it
Ever go out or
between every time.
Dr. Who?
Steinmetz?
No.
Was he, I couldn't remember if he was already gone
Yeah.
up there.
I
I ran into him the other day. He looks really good.
Are we good?
Do you have a
Yeah.
special needs child?
Yeah.
Okay, he left right after your name.
And, so anyway, I talked to him, and the very next day I'm on Instagram,
Yeah, I put it over there.
and they had an awkward family photo thing, story come up, and it was somebody that ended up in the ER on their wedding day. And
Hello.
he's in the picture.
Oh my gosh, hi.
It was their wedding day.
Glad you guys are here.
Hayden's gonna talk to you now.
Okay. Okay. So this is Andy Johnson. He's 63. Came in for severe abdominal pain, complaining of like Cox-Brown emesis and stuff. We took him to CT and it shows severe diverticulitis. You're going to take him to Cox South for emergent surgery, probably. He actually became altered. The doctor decided to intubate, so he had back about 45 minutes ago. Kind of hard to bag, I'll be honest. He said 7.5 tube. It's 24 at the teeth.
Is that 24?
Yeah, that's what the doc said when he placed it. Currently, we've got him on probe going at 22 mils an hour. Octreotide is going at, hold on, sorry, 30 mics an hour. And then dopamine's going at 5 mics per minute. Vital signs, respiratory went to go get a different vent because it wasn't. So his vital signs, heart rate's 130, pressure 70/40, he's at 90%. And then respirators on back at about 30, I think.
We have an input.
No,
Probably.
you might have the ability to get one, but I don't.
Probably do. We could probably slow down his bagging just a little bit.
Oh, okay.
You said he's hard to bag.
He is.
24 teeth. Any allergies?
Amoxicillin, I think I have a,
Oh, sweet.
yeah.
How can you?
Oh, it is a hospital.
You know better.
I know.
You said amoxicillin?
Yeah. EKG right here. It's just text. And then there's some labs and orders. There's an order for bank.
You have the bank.
I do. I have not started. I just thought I'd send it with you.
He said 24.
That's what the doctor said when he put it in. I mean, I've been bagging him for a while. Respiratory took off a long time ago.
Dig it for a flash.
Okay.
Alright, it looks like it's about 27 right now. And they're diminished on the left, his long sound, so I have to back that up a little bit.
Okay.
So we get our airway kit out.
What did you?
Just blade, or a C9.
You want that?
I'll have those this way.
You bet.
More specifically the Actria side. Thank you.
Yep. I have NG placed and there's 900 mils of poppy gunners out.
Thank you, places.
Okay. What can I do? Am I in your way? Okay.
How's he reacting right now?
He seems
Is he
chill.
asleep?
I mean, yeah, I think so. He's not fighting me.
Looks like I've got a heart rate of 130, blood pressure is 70 over 40, and title's 24, breathing 20 times a minute, and then 90% on your FiO2.
Thank you. It's 24 T. How's he bagging?
Much easier.
Thank you.
Alright. We have fluids hanging too.
No, he's had 2,000 in. That's an art one. That's on the left side here.
Do you have fluids?
Do I have fluids?
Yeah.
I mean, no, I have the vein. Here's the vein. He's already had 2,000 in, so I don't have any more.
Probe's hanging. He's doing okay. Pressure's soft.
Yeah.
He's only 5 mics per kilo per minute on the propofol.
The probe's at 22 mils an hour. It's supposed to be.
2.2 mils per hour.
Oh, oops, that's my fault. No, it should have been 22.
22 mils per hour.
Yeah.
Okay. He's asleep right now. So I think he put fluids on. 5 mics per kilo.
That's the dopamine, yeah.
Hmm?
The dopamine's at 5 mics per kg per minute. This is the probe. Right there.
5 mics per kilo.
Oh, okay.
I think they're just both 5.
Hmm?
This looks like they're both 5.
Okay.
Yeah, that one's right.
Pressure's still low. He's already had fluid. And title's high. Still tachycardic. I'd like to transition to a different pressor. We can either start levo now and then transition the dopamine down and turn on vaso, or we can just start vaso right away. Did you get a hemoglobin? Is that on there? Oh, there it is, 6. He's got an OGN, you said?
It's an NG, but yeah.
NG, it's hooked up to suction?
Yeah, and we've got 900 out.
Oh, okay, so we'll need to start blood too. Blood is back in the aircraft. We've got, I'd like to go ahead and start some levo now.
I have some.
Get that started at 5, thank you.
Some tubing.
You want me to come over and,
Yeah, I got your octreotide going so far.
thank you.
Oh, don't flip the thing.
Yeah.
Thank you.
Flip it over. I bet he's gonna start priming everything upside down. It's not a bad idea. Nothing wrong with it.
I got vinegar in my eye once.
Probably clings to everything.
What?
That one.
Oh.
Listen here. Did you say you didn't have any fluids?
No. He's already had 2,000, so I didn't have any more laying.
Oh.
just got prop over here now.
So this was octreotide.
Yeah.
Those compatible, I think.
They are today.
Like it. So I think you're taking off dopamine there.
Still on right now.
Mm-hmm. It's on my pump, yeah.
Yes. Okay, Evo's running.
Any other drifts you want me to get going?
Start propofol, should already be programmed. There. You wanna work on that?
Yeah, I can.
Propofol should be good. We've got Evo going. Dopamine is still hooked up currently.
Do you want to keep it?
For now. We get a pressure after this Evo. Heart rate's still elevated, so we'll probably titrate off. I don't want to turn it off until I get a pressure with my Evo.
Or are you just going to add on to that?
Here, so yeah.
Okay.
Alright, pressure's coming up with the Evo. We're going to titrate off the dopamine. We're at 5, so I'm okay. Just shutting that off.
Dopamine.
Yeah.
Alright, dopamine is shut off.
We'll get another pressure after that's off. If we need to go up with our Levo, we will. Or we can add another compressor. Octreotide, we're switching propofol over. He's gonna need some blood. We've got the blood in the aircraft. We got this set up.
Do you want this or just let it hang?
Yeah. Rope's going.
We'll work on getting the art line set up.
It's still at the 5. Might take a minute.
For the what?
The propofol.
Until we can just pressure up a little bit. If we need to give push dose, we can for sedation. We'll get art line set up, transferred over to our monitor, and work on the back.
Okay. You hand me the cable, I can plug this one in.
Is it over here? Where's it plugged in on this?
Just slide it in that yellow pouch there.
It just magically, very nice.
We'll just have to zero it when you're ready.
Really sensitive.
All right, we can zero it if you're ready. Push running right now.
These your down arrows. Keep going. Keep going down.
If I go back.
Hit the home button there.
All right, pressure's coming back down. We'll titrate up on our Evo.
Okay, go back up.
Oh, sorry, I got you.
Stop. There.
All right, you ready?
Ready.
Okay, zeroed. Not doing anything, is it good?
Yes. Alright,
Okay.
clamped up.
All right.
Okay.
Got Levo titrated up. We'll get a little more pressure. work on switching this last. Okay, we'll work on some vaso, but we'll mix up 20 units and 100 mLs.
Alright, am I doing that now?
No, we'll have to, well, do we have the bags? Yes, we do. Yeah, we can do that now.
Okay.
We got bags behind you.
You have 100 ml in there?
Yeah.
Still bags.
Yes, I'm still bagging. Very consistently.
How tall is it?
60 inches.
60. That's not nice.
Well. Oh my God.
Set up. Oh, I was gonna clamp it there.
Clamp it. Sorry.
Alright, got 15 over 5, 100%. We did our checks this morning when we came on. Vaso. 20 units and 100. We got two.
I don't know, I brought 3.
You said what?
So no, we brought 3. I don't know if we brought 4 or not.
Changed it.
There you go. It's clear. Okay. I'll figure out some things we need to set over.
Okay. As soon as we get that vaso started, we're ready to switch over to the vaso. Got that going. We're on the monitor. Waiting on vaso. We have fluids. I have fluids going. Hospital's out of fluids.
I know where some are. Where did you want me to put this? Like what pump?
I will stop the arterial type for now.
I can't see it, yeah. Sorry, I'm upside down. We've got 20 units in, 100 mLs, starting at 0.04 units per minute. Alright, we're going.
Do you need lift help again?
Yeah.
Probably.
Where's that room stalker guy?
The room stalker.
Yeah, there was a guy stalking rooms.
We
We
had a
need lift
helpful-
help.
We had a helpful warrior earlier.
bad.
Let's bring
Yeah,
the
it
vent
does. It smells
in
really bad
someone's
too.
hand. Perfect. And then pull the eye back closer.
All right, ready?
You got 10?
1, 2, 3.
Alright, checking last pressure. Got fluid in the aircraft.
You want me to carry
blood
the
and
vent?
fluid, so we'll be good.
Do you want me to carry the vent?
If you
over?
could, yeah.
Sure.
Just here.
Yeah,
Alright,
just
hold up.
cool.
Get that.
Yeah.
Okay, there. Alright, sweet.
Yeah, 25.
Alright, perfect.
Slide it back out. Alright.
Still on.
Okay, so, but is Zane still in here?
Oh, I don't know where you.
That's okay. He's not. Okay, anything you would do different, take back, and then stand over here so they can hear.
Probably would have started Levo quicker, titrated off the his other presser quicker, gotten out to the aircraft. He needs fluids and blood, he needs surgery. We can give pressers all day, but he needs resuscitating, so.
Okay. Yeah, sorry, the fluids. And the fluids, I mean, they would have some in there, we just didn't have any today, so. But that goes along with some of the other things, like, but if you don't have it and you know where it is, then
Yeah,
get to where you
just
need
get
to be.
there as soon as possible.
Yep. You cockatooed quickly, which was good. And then you waited to turn the dopamine off until you had something else established. I can appreciate that. What about the propofol? Keep it, get rid of it.
I honestly don't like propofol. I would have probably just discontinued it, but with the, that break this. With
Push that tab.
the state that he was in, I didn't want to change too much all at once.
Sure.
So if he's sedated and comfortable there, I mean, obviously it's not helping his blood pressure, but,
Bingo. It's a super low dose, don't get me wrong.
That's what I mean,
But
it's
it's still
at
5
5.
per kilo, right?
yeah,
So you start adding up some kilos and they can be getting a bigger dose than you might realize.
right.
Propofol, it just doesn't work that great in our environment. I have no problem keeping it on, but if my pressure's 70/40, I'm gonna get rid of it. I'd rather get rid of that before the octreotide, because the octreotide is actually treating the problem that you've got going on.
Right.
So that would be my advice on that.
Okay.
come too quick, which is good. With the labs, like again, you knew what we needed, it was just not available to us in the room, so you start getting out of there. I don't know.
Yeah.
You can, it really is dealer's choice, because you could be like, well, let's just push dose to get us out of here so I can get to my more fluids in my blood
Right.
and then start them out there. I'm not saying that's the correct thing.
It's an option.
That becomes just, yeah, that genuinely becomes dealer's
It would
choice.
save time as opposed to setting up drips and all the things.
Right.
So.
Sometimes you can't leave though until those drips are established, right? So that's where it's like, there's not like a single right answer by any means. Okay. So we'll reset this real quick. Your next step is take your binder to OTC and then look